Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine, and I'm also the host for the Dean's Chat podcast. One of my goals on Dean's Chat is to highlight different work opportunities within our great profession. Today's guest, Dr. Austin Matthews, is from Torrington, Wyoming. He is the staff podiatrist at the Banner Torrington Community Hospital. Torrington is in Wyoming. It's northeast of Cheyanne, I believe, and is certainly considered a rural community. Austin, thank you so much for joining me on Dean's Chat today.
Thank you. I appreciate the opportunity.
That's great to have you. And on Dean's Chat, we're pretty informal, so I'll go with Austin and Jeff if you're good with that.
That's great.
So, Austin, I was just going to tell you, you're a graduate of the Arizona College of Podiatric Medicine in 2012, correct?
Correct. You got it.
You probably remember those January days in Phoenix when it hit 40 degrees and below. Today's one of those days. So I'm sporting my Patagonia sport coat today.
Oh, yeah. See, I don't wear a vest, and that's probably what it is out here. I'm just used to it now. So.
Oh, our blood's a little thin out here, Austin. Well, I'm really excited to have you here. Thank you for joining me.
Yeah, thank you. I appreciate it. This is going to be fun, I think.
Oh, I think so too. So, I get asked all the time about different work opportunities and whether they're private practice or hospital opportunities or multi-specialty groups or orthopedic groups. One of the areas that we don't get to touch on a lot is rural practice for podiatric medicine. So I was hoping maybe you could shed some light on your experience, how you got there and what was the draw and what your experience is like.
Yeah. So I'm originally from Idaho, born and raised in a town of about 10 or 12,000 people. So I sometimes tell the story. My primary care doctor growing up was actually the doctor who delivered me. He delivered me, was my primary care doctor. I never had a pediatrician. And until I moved away for college, he was my doctor. That really wasn't the type of environment I wanted to practice in, actually. When I was in school at Midwestern, I had dreams and goals of being the podiatrist who practiced in a big medical center, a big name facility. But my first job out of residency was at a small town in North Carolina, and a fairly small hospital. It's about a 100-bed hospital, but me and my partner were the only podiatrists there. In that small community, I just loved the environment and really it felt right to me. And I think part of that is my upbringing, being from a small town. But there's just so much stuff that I really love about a small town that I didn't have in some of the bigger cities that I lived in. So when the opportunity came for me to leave North Carolina, I wanted to head back out west, and I really wanted to practice in a small town. The town I'm in now, Torrington, is about 6,000 people. You're right, it's northeast of Cheyanne. We're about 75 miles from Cheyanne. And so I was looking, and they were looking to hire a podiatrist. They've never had a full-time podiatrist here. But it was actually the family medicine doctors here who said, hey, we need a podiatrist. So I think that really set me up for success. They were interested in me succeeding. So it's been a great opportunity here, and it's been fantastic.
What are some of the unique challenges and opportunities, if you will, of working in a rural environment? What is your encatchment? I imagine it's pretty large.
Yeah, so the county that I'm in, I'm the only podiatrist. We have a satellite office about an hour away. I'm the only podiatrist full-time in that county as well. I think there's one podiatrist who comes and visits a nursing home, but that's pretty much it. We do have another county kind of northeast of us that doesn't have a podiatrist at all. So I get patients from an hour and a half that come and visit me. So it's a big area geographically. As far as population, it's not that big, but it's a lot of traveling for people.
I can imagine, when I was in practice in Denver, we used to have, for wound care specialty areas, we'd have people come down from Vail, or they'd come down from Fort Collins. They were willing to make the trip. Are you seeing a lot of patients that are making large commutes to your practice on a weekly basis?
Yeah. I don't do as much wound care as I used to when I was in North Carolina. But for those patients, I do have patients. I saw one today who came from a little over an hour away to see me. And that's not uncommon. In And that's probably one of the biggest challenges in a rural community, is not just for me, but for if I have somebody who needs to go see a specialist, it's a little bit of a commute, and it's a challenge to get people places, especially for those really critical things. Our closest vascular surgeon is 45 minutes away. If I have a really complex, say, Charcot case that I need a second opinion on, or I don't do too many of those. So if I send it out to somebody, they're probably, looking at Fort Collins or Greeley, Colorado. So a couple of hours away.
No, that makes sense. I know the Greeley folks for sure. I helped start that program in North Colorado. So there's a lot of good friends there. When you did your residency in Detroit, right? St. John at Macomb?
At Henry Ford Macomb.
Henry Ford Macomb. Okay. Dr. Lodor, I believe?
You got it.
Okay. So that was a busy, excellent opportunity for you. Obviously prepared you for rural medicine, because you got a lot of things coming in the door, I imagine.
Yeah, and that's actually one of the things that I love about it in rural medicine is you can see all sorts of different things. It's really hard to be a subspecialist in a rural community, I think. And that was, initially when I was in school, I wanted to specialize in something. But when I got into practice, the big surgical cases didn't interest me. I did not enjoy them. And so being able to see pretty much anything that comes in the door, treating a wide variety of things is one of the things I really love about the practice. The flip side of that is there are some areas where I don't do as many cases with. And so skill atrophy is something that I do think about sometimes, and, try to figure out ways that I can combat that, whether it's through courses and extra trainings and stuff like that. Because, I don't see too many calcaneal fractures, for example, but part of the reason the hospital wants me here is so that if something like that happens, we can keep that in the community. So that's one of the biggest challenges, is that sort of push and pull between trying to provide value to the community, but also understanding that I don't do those that often. And where's that line between those cases that I feel comfortable with and not?
That's a new term for me, skill atrophy. Bring a little anatomical reference to skill set.
Yeah, exactly.
That's fabulous. Well, that makes sense to me, though. It really does.
Yeah.
So you're no stranger to being involved, though. I mean, you're involved with ACFAS on multiple levels right now.
Yeah. And, really, I think that my involvement actually it really has only come since I've moved here to Wyoming. And I think that sort of shows for students and even residents, when you find that spot that you really fit in, that a lot of things can happen. Because I've only been in Wyoming for a little over 2 years, but like you said, I've had the opportunity to be involved with ACFAS on a regional level, but then also with the Leadership Development Program. I had the opportunity to speak at the State Advocacy Forum. So I've just had all of these opportunities that have just been really beyond what I ever expected. But I think that when you find that situation that just really works for you, this profession offers so much that, that right situation just brings it out.
Oh, that makes sense. So I'm interested in your involvement with the Chris Mahaffey Leadership Development Program. That's a new initiative with ACFAS, right?
Yeah, so this is their first year. There's 16 of us that are in the inaugural cohort for that. So.
Right. Okay, because I was talking to Bryn Laubacher. Bryn is in Chicagoland area, and she and I were talking about some of the challenges with student recruitment. Do you have a specific area that you're delving into in this program? So for our capstone project, we're broken up into 4 groups that we're doing some research and coming up with ideas for how to combat these challenges that our profession faces that we're presenting to the Board of Trustees at the annual scientific conference at the end of this month, beginning of February. So, very good. What project are you working on? What's your capstone?
So I'm in the group that is promotion of the specialty, which is how do we get the word out about podiatry? And we've sort of taken an approach of how do we get the word out to not only other doctors, how do we get it out to hospitals, but also how do we get that out to the public? How do we inform the public about what we do as podiatrists? And one of the things that I've really sort of made as my little project within that is I think podiatrists can have a much bigger foothold in rural locations like I'm in. There is a lack of services for a lot of these people. For a lot of locations, the diabetic foot infections get treated by vascular surgery or general surgery. The foot and ankle trauma gets treated by orthopedics. Generally, a general orthopedic surgeon, there's a lack of foot and ankle orthopedic surgeons. So I think that there is a lot of room for podiatry to really grow in the rural community. And that's sort of been one of those pet projects of mine within this capstone project.
No, that makes sense. And two things coming together at the same time. Your experience in rural medicine, you see the deficit. You also are involved with ACFAS. That's interesting because if you were to ask me what two of the biggest challenges are in our profession, one is branding of the profession for the public, and the other is, from my perspective, recruiting great students into the profession that can lead the charge going forward. But they go hand in hand.
Oh, absolutely. And I think that not trying to spoil my presentation, but one of the things that I hope to bring up in this presentation is I think there's a lot of ways that not just ACFAS, but the profession as a whole can promote podiatry in that rural space. For example, a lot of our family practice providers did a lot of rotations in rural medicine. There were those opportunities, and I'm not aware of any opportunities for podiatry for rural medicine rotations, rural podiatry rotations. There's in the family practice realm, there's working groups and committees on rural medicine. And I think that there are some opportunities for us in the podiatry world to look at those things.
I think you're right, Austin, because all you have to do is jump on an airplane and fly across the country and you can see the vast expanses of rural America. And there are people everywhere, right?
Yep, no, absolutely.
I like that. I think that's brilliant. I'm glad you're involved in that. Thank you.
Me too. It's sort of worked out like that. I wasn't necessarily thinking about that when we kind of broke off into our groups for the capstone project. But the more I looked at it, the more I thought, this has been such a great thing for me. And I think that it's such a great opportunity for the profession that, we can really make an impact.
No doubt about it. Now, you are involved with the Big West region, right? With the American College of Foot and Ankle Surgeons. What does that entail, Austin?
Well, so right now I'm the vice president of the Big West region, but the vice president position is probably the one that maybe does the least. The secretary or the treasurer position handles all of the finances. The president meets in the president's council and the big initiatives, and the vice president, I have to fill in if our president has something else going on, and give input and be part of that group. But my responsibilities at the moment are fairly minimal, but I'm in line to become president next year or 2026. I can't remember. So that'll change.
Oh, very good. That's a common theme, though. I'm with the AACPM, the American Association of Colleges of Podiatric Medicine. And when I was secretary treasurer, we had a fair amount to do, of course, as you always do. Then I was the vice chair. And when I was the vice chair, I didn't have much to do. And then last July, I became the chair. And I was like, holy cow, there's a lot going on around here. So you're not alone. So you just get to prepare yourself for the storm.
Exactly. Yeah, I'm trying to prepare.
No, that's great. So let me go back even further, Austin. How'd you find out about podiatric medicine?
In high school, in my first year of college, I actually wanted to become a high school science teacher. That was my plan. I've got teachers in my family on both sides. But I noticed a couple of things that sort of turned me off. And one of them was a lot of my teachers took on extra responsibilities at the school that they didn't necessarily want to. They were in charge of the yearbook or they coached extra sports, and they did that to make extra money. They got paid more for doing that. And then a lot of them wanted to move up into administration or were moving to better paying jobs. And I thought, if I became a teacher, I just want to teach. And so, looking back, I don't think those were great reasons for me to sort of put it off, but at the time they were big deals. So after my first year of college, I moved home and I just stayed home and worked. I didn't know what to do. And I just lived at home and worked for a couple of years while I tried to figure my life out. During that time, I had a little bit of what you could call a spiritual awakening and ultimately decided I wanted to be a missionary. So I became a missionary, and I was assigned to be a missionary in Munich, Germany, and Austria. So the person in charge of us there was a retired vascular surgeon from Detroit, a guy by the name of Leroy Worthland, great guy. And he would tell these fantastic stories about these big cases. When he practiced, I don't think there was a lot of endovascular stuff. It was all big open aneurysms and bypasses. And he would tell these great stories. And that was really the first time that I ever considered medicine as a career. And I didn't know what I wanted to do with medicine. I had this experience where I was in Munich, Germany, coming up out of the subway, and I just was thinking about this. What do I want to do with my life? How is medicine going to play a role in this? And I just happened to look, and it seemed like everybody I saw had some problem walking. And I think looking back, we lived in an area of town where there were a lot of people from other countries, a lot of refugees. So, neglected club foot and massive limb length discrepancies and all this stuff. And it just sort of hit me. And I thought, I'm going to help people walk better. And, when I came back to school and went back to college, we had a introduction to health professions class. And that really is when podiatry was sort of introduced to me. And I started, researching it, looking at the website, and trying to gather as much information as I could. And that's really what set me on that path. One of the things that is also interesting is one of the ways that I got a lot of information was Student Doctor Network. And I imagine it's probably still the same for a lot of the students that you see. But that actually set me off. I ended up volunteering with Student Doctor Network. I was a moderator there for probably like 10 years, really a long time. But I haven't been on there for several years, but that was quite the experience too, and seeing a wide group of people, both positive and negative. And that was interesting as well.
Oh, I'll bet it was. Let's circle back on that. I want to talk about student.net more. So then how'd you end up in Glendale, Arizona at Midwestern?
Yeah, so actually, after I decided podiatry was the field for me, my wife, I had just recently gotten married. My wife and I sort of sat down, and at the time there were, trying to think, 8 colleges, maybe 7. We basically just looked and said, well, where can we see ourselves living, and picked out the places that we could see and applied there. I got accepted to OCPM in Cleveland. And I had also applied to Des Moines, but I had been put on hold there, and I came down to Midwestern and had just a fantastic interview. It's obviously a great campus. Dr. Page, the dean at the time, was just amazing, and it just felt right to me. And that's kind of been the story of all of these opportunities that I've had, practicing in North Carolina and here in Wyoming. I sort of go by my gut a lot, what feels right. And Midwestern just felt right to me. And it was a fantastic time there. My wife and I still look fondly back on those days, even though it's been, 11 years since we moved.
Right. No, that's great. It's just a fabulous school. Students come first. Lots of tremendous efforts have been made. Since you were here, they put the podiatry lab, the new lab, they put $1 million into that. There's a simulation center. Taking classes with the DO students is a highlight for our students also.
Absolutely. And that was one of the things that really made me want to apply there. The small class size was a big draw. And then working with the DO students. So, and then everybody I met, there weren't, in 2008 when I started, there weren't a ton of graduates from Midwestern yet. It's still fairly new, but everybody I talked to had heard nothing but good things about the school.
They had a great faculty, and you got to credit Dr. Page with putting it together. Dr. Page was my mentor in California.
I remember I listened to the podcast where you talked to him about that. And it was something I did not know, but that's really interesting.
Yeah, no, he's a great guy. So then you went to Detroit for your residency.
Yes.
Kind of like me. I went to Detroit too. I did Kern back in the day. So my wife and I loaded up the Ryder truck from San Francisco and crossed the Bay Bridge and headed to Detroit. You did about the same thing.
Yeah, pretty much. We put it all in a U-Haul and drove from Phoenix up to just north of Detroit. Yeah.
Very good. What was that experience? How was your residency experience?
Oh, yeah. Residency is an awesome experience. Henry Ford Macomb Hospital, this was really right at the time that the allopathic and osteopathic residencies were in the process of merging. So we were still mostly DO residents, but there are a lot of different programs, general surgery, orthopedic surgery. And so that was a great opportunity to connect with a lot of other residents, a lot of other specialties. And, that was really a great introduction to how things should work out in the community, all the specialties working together, and we got along together really well. But like you said, residency's busy, lots of surgeries, but I had a lot of great mentors that helped me out through that. And Dr. Lodor, who's the residency director, has been the residency director the whole time. He started the program. He's still the residency director. Is great. He was really the first one who sort of sat down with me, recognized where my weaknesses were, and helped me work through those. Some of the other attendings that I had worked with, if you made a mistake, they would just take the knife from you, not really work with you on that. But he would be, all right, you did this wrong. Let's work on it. This is how we do it right. And so it was a fantastic experience. Yeah. Didn't love the weather so much, but everything else about it was great.
Well, when I was looking at your CV, I was intrigued. You're not afraid to go out and try new things, right? You went from,
Sure.
You did your mission work, and then you were back home, and then you were in Glendale, then you were in Detroit, then you were in North Carolina.
Yep.
And now you're in Torrington.
Yeah, it's been an interesting path. One I certainly wouldn't have predicted. Actually, when I was looking at third year and fourth year rotations as a student, I had this idea in mind that I was going to do all my fourth year rotations on the West Coast. I was going to stay on the West Coast, only visit West Coast programs, do my residency there, practice there. And it just didn't end up working out that way. I think you have to be a little flexible, but it worked out great for me, even though it didn't work out how I thought it should.
Same situation for me. I was going to school in California. I thought I'd never leave.
Yeah. Well, and you've been in Miami and Arizona and Colorado and over.
You got it. So, hey, let's talk about student.net for a couple more minutes. I find that interesting because you're right. I mean, I've been on there off and on since probably 2008 or 9, maybe.
Yeah.
And I always enjoyed it. I mean, you have a little bit of rebel rousing at times, but there's some really good advice on it. But I will tell you, over the last few years, it's been a challenge, even for recruiting students. Because if you want to find out about podiatric medicine, you Google podiatry, SDN will come up, and if you go on there, there's under anonymity, people just let it rip, and they don't. Sure. And so that's a challenge. What are your thoughts on that? I mean. We do our best, to represent our profession, and there's a segment of our profession that's on there, and they're not glad they're podiatrists,
Sure. Yeah, it is a challenge, and it was a challenge as a moderator because you don't want to stifle people expressing their opinion, but you don't want it to become just a negative place that doesn't really show the true side. So I always try to just show my experiences, positive experiences. The interesting thing is I got to know a lot of the people on there outside or past the shield of anonymity. And a lot of the people who, at least at the time, and like I said, I haven't been on there in several years, who were negative about it really had great opportunities and were doing really well. And so I never understood in a lot of situations why people were so negative that were doing so well. And I don't know that there's a great answer for that. Like I said, I think that the best thing is just combating that with things like this podcast that show the positive side and show the opportunities that are there. Because under the shield of anonymity, people will not always say the positives. They'll lean towards the negatives. But I think things like this show that there are, more positives than negatives. Our profession's not perfect, but it is not as bad as it's made out to be.
No, I'm with you. There's two moderators on there. Their handles are Weirdy and Dexter. And
okay.
That's not an easy job. I don't envy them one bit. I mean, they're constantly being pushed and pulled in different directions, and they do a good job. And it'd be a tough position.
It is, and it's obviously a volunteer position. It's not something that I ever got paid for, but it is. And it's interesting to see sort of the backside of that, to see how the moderation happens, and the discussion that goes on, and how do we approach this. But then also, I ended up becoming up higher and higher, moderator to senior moderator to site administrator, and, seeing some of the big picture discussions as far as what does Student Doctor Network look like, big picture, long term. And so that was also interesting as well. But yeah, you're right. It's a hard job. And that's ultimately why I ended up stopping doing that. It just ended up taking up so much time. I was new in practice, and it just became hard to keep up with everything.
You're to be commended for giving back to the profession. Well done.
Thank you.
So, Austin, what do you tell a student who's taking sciences in college and he hasn't quite figured out what he wants to do or she wants to do with their life, and they're contemplating a career in podiatric medicine? What do you tell a student like that?
Yeah, I would say that my experience has been pretty much nothing but positives. It's a profession that is challenging at times, but I think that anything that's worthwhile should be challenging to accomplish. Not only graduating, but then residency is challenging. Going into practice is challenging. And all of those things set you up for success later on. If I was a patient, I wouldn't really want a podiatrist who'd never handled a tough case, who had skated by. Those challenges make you a better person, make you a better physician, I think. But there are so many opportunities in podiatry, and you had mentioned some of them. When I first graduated from residency, I started in private practice, a small private practice, me and my boss, my partner. We then, after 2 years, became part of a hospital system, brought in another doctor, so there were 3 of us. The year after that, we became part of a larger group, so there were a total of 10 or 12 of us in our group. And here I'm part of a hospital system, but in a totally different environment. I'm in a rural community as opposed to more suburban. And those are all opportunities in podiatry. If you want to practice in a big academic center, you can. If you want to practice in a small community, you can. And that's been one of the things that actually with the Chris Mahaffey Leadership Development Program, there are podiatrists from a lot of different backgrounds, a lot of different practice situations. There's residency directors, fellowship directors. There are people who practice in big name hospital systems. There's me who practices out in the middle of nowhere. There's all these sorts of different things. And podiatry can offer them all, whatever you want. The podiatrist can practice part-time. Podiatrists can practice, 60 to 80 hours a week if you want to, and take a lot of call and do a lot of surgery. You can do no surgery. You can do all sorts of different things. So I don't know that there are very many specialties that offer as much as podiatry does. You're confined to the foot and the ankle from an anatomic standpoint. But within that, there are so many opportunities that, if my kids wanted to go into podiatry, I would absolutely encourage them to look at it.
Absolutely. Well, all specialists are confined to an anatomical region typically, right? So I get that. No doubt. And I echo your sentiments exactly. If one of my kids wanted to go into podiatry, I'd be all for it.
Sure. Yeah. And who knows? My kids I have a 15, 14, and 10-year-old. So they're still a ways off. But, if they were interested in it, absolutely come and chat with me. Let's talk about it. But I'm not the type to say, hey, let's make this a family business or, anything like that. But
I'm with you. So you're obviously, you've got a family, you're busy, you're in your practice. What do you do for fun? This is kind of the fun part about the podcast, right? People learn about people. And I mean, look, I learned you were a moderator at SDN, right? But what do you do for fun? I mean, what's unique about when you turn it off?
Yeah, so one of the interesting things is my wife and I actually just recently became foster parents.
Congratulations.
So thank you. So we actually, about 3 or 4 months ago, got 3 foster kids, 3 siblings that are 14, 7, and 3. So that's kept us pretty busy.
Wow.
We went pretty much overnight from having 3 kids to having 6 kids. So,
oh, my hat's off to you! How exciting! What a special opportunity for those kids. That's fabulous.
Yeah, and it's been really interesting for us too. I mean, being involved and seeing some of the things that we had never really been introduced to before. Some of them we didn't really want to, the court system and the Department of Family Services and those sorts of things. But it's been really at times gratifying to see, helping these kids out that were in a rough situation before. That's been kind of the newest thing. I really like working with my hands, actually, and I like learning new skills. So about 6 years ago, I had a patient who introduced me to her husband, and her husband made custom knives. That was his hobby. And so he sort of talked to me about it and introduced me to it. So for about this past 6 or 7 years, I've actually dabbled in some knife making stuff.
Oh, neat.
And that sort of led to some leather working and some woodworking and just some little hobbies like that. But yeah, I make maybe 6 or 7 knives a year. I'm super slow at it, but it's just something I get to do, work with my hands. And that's probably the best thing is learning a new skill, working with my hands. And there's a lot that carries over to podiatry actually with that, the hand-eye coordination, fine attention to detail, all of those things kind of come together with that. So that's been, as far as a hobby, the thing that I spend the most time with outside of family.
That's awesome. How long does it take to make a knife?
Oh, so that depends. There's different steps. And so one of the most important steps for people who've watched the show Forged in Fire on TV, one of the steps they do is they quench a knife, or they heat it up really hot and then you cool it really fast. That's what makes it hard from like a bendable piece of steel. So that part I don't do myself. I send that out to somebody who can do it in a digitally controlled oven with really accurate temperatures and all of that. So that process by itself, it takes, a month for me to send them and get them back. So, I mean, total time is, I don't know, 30, 40 hours probably on each one that I spend. But that's over a course of several months.
Sure. Well, how exciting. Yeah. That's fun. It must be neat to, when you're all done, say, I made this.
Yeah. And, it's, some people do it and sell them. I do them. I give them away. Like I make, this year for Christmas, that's what I gave my mom, was a knife for the kitchen. And she sent me a picture of her cutting cucumbers with it. And I was like, oh, that's pretty cool, to see something that I made help somebody out. So that's been fun.
Oh, that's awesome. All right. Well, gosh, that's so fun. And kudos to you and your wife. I can only imagine how fulfilling that must be to bring in foster children. That's great.
Yeah, there's definitely been, my stress level has gone up quite a bit over the past couple of months, but there have been some really great moments in that too. So.
Oh, that's great. Well, I want to thank you for taking time out of your busy schedule to join me on Dean's Chat. Thank you.
Yeah, absolutely. Thank you very much. Dr. Simon, who is the one who introduced us and sort of put us together. I met her at the State Advocacy Forum and had listened to the podcast before, but had never really considered myself as a good candidate to be on there. But she sent me an email and said, hey, I'm going to connect you with Dr. Jensen. And it's been awesome.
No, I'm so glad we were able to connect, Austin. It's always good to talk to our alums too. You ever want to come back and give a talk in Arizona, you give me a holler. We'll make it happen.
Well, absolutely. I need to talk to Jeff McAllister, our region president, and see if we can't come up with something here pretty soon.
Let's put it together at the university. That's great.
Yeah, that'd be fantastic.
All right. Well, I'm going to send you one of these Dean's Chat cups. It sounds like you're working some hours and you're going to need some beverages to keep you going. So that's great.
I appreciate that.
You're welcome. So to all of our listeners out there, by all means, thank you so much for joining us. If you're listening on Spotify or Apple Podcasts or Google Podcasts, please give us a 5-star rating. And if you're watching on YouTube, please become a subscriber. And until next week, cheers, everyone. That is awesome. Great work, Austin.
Oh, thank you.
Thank you for joining me. Oh my gosh, that's so fun. I get to do these a couple times a week, and sometimes what I do is I come down to the studio and I do 2 in a day, right? That way, saves travel time and stuff.
That makes sense.
You're going to laugh when I tell you this. So David Alper, I interviewed him just before you. Yeah. He also dabbles in being a blacksmith. He makes knives and things. I thought, oh my God, today's the day, Maybe I need to start doing that.
Oh, that's funny. I didn't know that. He actually was the one who, when I spoke at the State Advocacy Forum, he was the one who kind of introduced our topic and sort of introduced us, because he's on the board of trustees for APMA, I think. And I think his region covers us. So
yeah. He's a great guy. I really enjoyed talking to him. Thanks for the insights on SDN. It's really been a challenge because they went off the rails here a couple of years ago, and people were just ripping the profession to shreds. And Weirdy and Dexter were just, I don't know, they almost seemed like they were part of it sometimes. And
and I think, I'm trying to remember, Dexter had become a moderator. I was a senior moderator when he was a junior moderator, I think. And so he took over. Weirdy I knew, but he wasn't a moderator at the time that I was there. It was probably like 2020 when I stopped. And it just, like I said, it just got to be too much. I just basically stopped. But then it wasn't too long afterwards that ABPM and APMA kind of sent out emails and said, hey, you guys should come onto the forums and provide some input so that it's not all negative. But I never really have been back. So
that backfired on APMA because, people would jump on one time and they'd pile on and say, oh, this is a great profession. And then they'd leave and never to be seen again, which just gave the locals a little more fodder. You know what I mean?
Absolutely.
So it's been interesting because there's some that just are relentless and they're very successful too. On one hand, on one thread, they'll brag how they're making $350,000 a year. On the next thread, they'll talk about how it's the worst profession. They never would want to do it again. Don't make any sense.
No, I agree. And like I said, actually one of them used to practice here in Wyoming. So I kind of knew his situation.
Well, that's Airbud. Airbud.
Yeah. I couldn't remember his screen name. So I know who he is and I kind of know his situation and stuff. He had a great gig. I mean, he was getting paid the same as I am, but he was seeing like 6 patients a day, like had tons of free time, lived in Western Wyoming, which is much more beautiful than Eastern Wyoming where I'm at. I'm like, how do you complain about that? I don't know.
And it was hard to come back. He's in Texas now. He's a Des Moines graduate.
Yeah.
And he is the founder of the meme thread.
Oh, okay.
And so they make memes about everything podiatry. And there's a lot to laugh about, and I admire their creativity. But if you're a prospective student and you get an SDN, and I've seen this over and over, and I wouldn't publicize it because they'd be so proud of themselves. I mean, people don't go into podiatry because of that site.
Sure. Oh, I absolutely agree with you. And I mean, it's unfortunate because, like I said, they, on the one hand, have great jobs. I mean, I know several, like I said, I know some of them, and they have great jobs, the exact jobs they wanted, but they just have a chip on their shoulder and just can't admit that they have what they want. The podiatry got them there.
Can you imagine being wildly busy and successful and getting on an anonymous site and just bashing the profession that got you there? It makes no sense to me.
Completely agree with that.
Yeah. All right, buddy. Well, congratulations on your success, and I look forward to seeing you here in Arizona. And you're always welcome.
I do have a question.
Sure.
I had sort of brought up rural medicine, and I think that there should be more focus on there. Would there be a way or a possibility of setting something up through the school, a rotation, if people wanted to spend like a month with me in a rural location?
Absolutely. Because remember, we did the orthotic 2-week rotation. If we can make anything happen, Austin. And I think some students would like that because, more and more they're talking about, I don't know if you got student loan forgiveness going there or anything. I don't know. But I mean, there's a lot of talk about that, right? And students are like, hey, I might be all over that Indian health or rural medicine. Maybe, I'm just going to throw this out there and I can help make it happen. Maybe having you come down and give a talk about rural medicine and what it's about. And then that we could parlay a rotation out of that when students know you, like, hey, I like that, I mean, I'm sorry, we didn't talk about that student loan issue, but.
Oh no, that's okay. But I think that'd be fantastic because, I mean, thinking back, I don't know if I would have jumped on that opportunity because that wasn't really what I was interested in at the time. But I think that getting people to practice in rural medicine can start in school and can start in residency. A lot of our family, we don't have any OB-GYNs here. And so we have family practice with OB. And a lot of those are rural, they have rural rotations or a rural track for their residency. And there's not really that in podiatry.
Our school has that,
Yeah. That doesn't surprise me.
In fact, I'll bet you, I'm just thinking out loud right now, from a curriculum perspective, for a rotation for rural medicine, the template's already there at Midwestern.
Oh,
we just got to tweak it for podiatry a little bit. Yeah.
And I think that a rotation in a rural practice like mine, I'm fairly, I don't want to say slow, but I see on a busy day, like maybe 12 or 15 patients a day. Right. And so I think for a student, that would be a great opportunity to come in. Not, I would be there with them the whole time. I wouldn't, like some rotations, you sort of get shoved off, like the VA. Right. You go do your own thing and you just pop in to tell the attending what you did. This would be a lot more hands-on, a lot slower pace, especially if a student needed that.
I think it would be outstanding because, it doesn't have the draw of a rotation where there's a residency. So that's not there. But the draw to say, hey, I open my eyes to what's available out there because that's another opportunity for me down the road. I like it.
And, we're only about 2 hours away from the Northern Colorado group. So if they wanted to go visit the program on a weekend, that's definitely doable or something.
Yeah.
Just to go check it out or whatever.
I'm just thinking out loud. I'm wondering if maybe there'd be an opportunity for students that are at that program to come visit you.
Yeah. I'd hate to steal them from what they're actually there for.
Yeah, no, I hear you. But you know what? It depends because if you open up another clerkship slot and people are getting more rotations and opportunities, I mean, we can always talk about that kind of stuff.
Yeah. And I have thought because I think the Northern Colorado program's through Banner now. I think that
it is.
Banner's a sponsoring institution. So that would really be an easy thing because I'm Banner too. I'm employed by Banner. So,
it's Banner. The North Colorado Hospital is Banner for sure.
Yeah, that's what I thought.
Yeah. And they do like to keep things in-house, as you know.
Yeah. And I've approached our staff, the admin here, and said, hey, I'm interested. If we did, get something going, would you guys be okay with it? We have students rotate from PA programs and from the MD program that are doing rural rotations here. So we already have some students coming here. So there's a lot of that groundwork already in place.
Yeah. So it wouldn't be like you're creating a new world. I like that's so important,
Yeah.
Let's talk more about that for sure. I'd be interested.
Yeah, that'd be awesome.
All right, my friend. Enjoy. Thank you.
Thank you very much.
I'm glad we could put it together. Okay, talk to you later.
Me too.
All right.
All right.
Bye-bye, Austin.
Bye.